I just get up my screen there. So you can see that there, I suppose you can. Yeah, okay. So I'm going to present for the next 15 minutes or so in terms of co-occurrence, in terms of gender dysphoria or gender incongruence, and ADHD, autism spectrum disorders, and maybe ODD, in terms of the co-occurrence experience from transgender people. I suppose when I was first asked to present at the conference, number one, I was delighted, but the name of it was a little bit jarring for me, given that some of our young people who do experience co-occurring um, um, difficulties, or I'm kind of afraid to say disorders, do not identify as either girls or women. So I think just to mention that point on that. And I think, really sometimes, in this photograph here on the bottom of, someone say, what does a transgender man look like? So I picked out an old friend from San Francisco who was quite famous in the area of transgender legal issues and healthcare, Dr. Jameson Green. And, when people refer to girls and women, especially, and then you look at, someone like Jameson, and he definitely doesn't look like a girl or a woman. So, but it's absolutely wonderful to be here. So I'm just going to speak in the next few minutes about co-occurrences I've mentioned, some of the gender difference, some of the theories and social factors, and some of the guidelines. I suppose that's a really crucial area for us. That sometimes there's a perception if a young person or an older person has experience of gender variance or gender incongruence or dysphoria, and also a diagnosis of ASD, then maybe it's because of the ASD and they don't really have gender variance or gender incongruence. So I think it would be certainly good to go through then some of the guidelines from the research, and that there is quite a bit actually throughout the globe. So as I mentioned, just like any population, trans people also experience co-occurring issues. Unfortunately, we are a stigmatized community, and we're marginalized. We experience minority stress because we're marginalized, and we would absolutely experience quite a lot of stigma. So if there is like co-occurring issues or anything else going on, it can be because of who we are in the world. Certainly. I would like to think that we've come further along the lines in terms of lesbian and gay people, but transgender people and transgender identities, unfortunately, would hold a lot of stigma. Just to mention, sometimes just to be identifying as transgender or gender transitioning in young people and adults, it's again perceived through a negative lens, which again can add into negative factors and how we are treated in healthcare. So I think, just to mention the point that, many of us go on to have very content lives, not wholly negative. My own research was in the experiences of adult transgender women and families of adult transgender women, relation to grief and loss, and really it came down to the dominant theme of ambiguous loss experienced from both. But there was also an element of ambiguous gain. Again, we look at the negative aspect, of transgender people's identities often, where there's also quite a positive that you can live your authentic self. So yes, there is a co-occurrence, and the research would suggest that. And there's many research studies at the moment from different countries, from different continents, from Australia to America, to some of the main ones here in Finland, from their gender identity teams, that there is a high co-occurrence of ASD and gender dysphoria within young people, certainly. 𝗩𝗲𝗀𝗀𝘀 et al. And 𝗩𝗲𝗀𝗀𝗀 et al. is Annalou 𝗩𝗲𝗀𝗀, and she's a psychiatrist as part of the Amsterdam team, which is one of the main centers in the world, especially for research that comes out of there. and 𝗟R𝗰𝗲𝘀𝘀𝘀, and I know you're going back 10 years or 11 years with this, but again, it can be more complex, I suppose. So in terms of just to disentangle, I suppose, an experience of gender dysphoria from ASD or other co-occurring issues is certainly a very important factor to understand. 𝗟R𝗰𝗲𝘀𝘀𝘀, again et al. Identified not only that there was high rates of co-occurring issues in terms of gender dysphoria and ASD, but also in terms of ADHD and ODD. Ken Zucker reported in 2017. He's one of the main researchers, I suppose, in transgender healthcare from Canada. Many trans people wouldn't be a fan of Ken's work, and he can be quite look at it through a negative view. But his study here, he's quite a great researcher. But in terms of his findings here, that many people across the board, in terms of different clinical difficulties, can be found in a range of different areas. So it's not just in relation to gender dysphoria. This study here, again from Van der Meissen, again in Holland, looked at the differences in terms of associations between gender variance and specific ASD characteristics. And again, looking at the difference in terms of how boys are raised and how girls are raised, and how boys start presenting in a gender variant way, and how girls started presenting in a gender variant way, and how that, again, if there's diagnosis of ASD or other co-occurring issues, again, how that can manifest, I suppose, in the young person experiencing them. Some of the theories, this theory here from Baron-Cohen, who was actually the cousin of Sacha Baron-Cohen, looked at empathizing and systemizing theory. I remember being at a conference in London, actually, and he was presenting, and it was very interesting in terms of his extreme male brain theory in terms of transgender people, in terms of that people on the ASD spectrum don't have high rates of empathy for people, find it hard to have eye contact, and this is his way of explaining trans men or trans masculine people, which is a really interesting theory, but it doesn't translate to trans women, the same theory. So I suppose it's an interesting theory, but at the same time, how do you understand that in terms of trans women who were assigned male at birth and then identifying as women? So maybe it doesn't translate as good, but again, it's a saturation of testosterone within the brain during them semesters. So in terms of the social factor hypothesis, I suppose, so you know, in terms of my experience, I suppose, and I might speak to this one in terms of my experience working with, I suppose, many families of transgender people and transgender people themselves. And, you know, I've worked with hundreds over the years. And, you know, I have worked with many families with children with and young people with diagnosis of ASD and other co-occurring issues. And some have experienced this from when they were, you know, very young, and the families would talk about their stories in terms of the young person, which they're often asked to do in terms of assessments, to talk about their story of their young person, where they could not conform to societal norms of what their assigned gender was, and again being overly diagnosed in terms of being on the ASD spectrum because of their persistence that they're not girls, that they're boys, and again, you know, it's you know, because and I feel because there's not a massive amount of people in Ireland trained in the area, and there's certainly not a multidisciplinary team in terms of Ireland either, that often these situations are missed. So in terms of young people, adolescents who are also on the spectrum and who recently identified as transgender and looking to start on medical interventions, it's quite different to a situation where a young person, a family can recount stories of a 3 or 4 or 5 or 6 or 7 year old child, but when they're put in the same waiting list to be seen, it is quite concerning. Whereas a more straightforward situation, or a more straightforward, I hate to say, diagnosis, whereas on the other side, it's a little bit more complex. In terms of guidelines, I am really delighted to say that there is some guidelines here from Strang et al. And that et al. Is quite extensive. And they would look at that to ensure that the therapists in both have experience in both ASD and gender dysphoria when diagnoses are done. In an ideal world where there's a multidisciplinary team, and it's a key thing here in an Irish context, where as much as we do have a service per se in Our Lady's Children's Hospital in Crumlin, it is very under-resourced. The only position in there at the moment, I think, is admin and a part-time social care worker, and there's a locum pediatric endocrinologist, but it is massively under-resourced, and especially when there needs to have, in terms of the International Protocol for Medical Interventions for Young People, to have at least 6 robust assessments, and if there is co-occurring issues in there, them assessments need to be extended. So in a situation in Ireland, we are not equipped for that, and we have been, I suppose, buying our assessments from the Tavistock Clinic in London, which have unfortunately had their own difficulties of late, and I can't really see the Tavistock people being involved in our service maybe in 6 or 8 months' time, certainly not in 12 months' time. But I would like then that we would be in a position that we have filled some of them posts, and we have that multidisciplinary team, and we can absolutely look at meeting the recommendations from the like of Strang et al.'s guidelines for working with transgender people. So again, just to mention that there is guidelines. Guidelines are available, so I'm not going to go through them, but just to mention strongly that there is absolutely co-occurring issues within the transgender community. It should not be a reason to exclude, I suppose, people who are also experiencing and are also on the ASD spectrum. That's a really important point to make tonight. It's harder to comprehend long-term risks and complication consenting for treatment. So I think to be very straight with young transgender people, if they're going through, or people who identify in a different gender during assessments, especially if there's ASD, be very upfront and explain what the treatments might encompass, because sometimes there is unrealistic expectations. So as much as I'd love to have another half an hour to speak about unrealistic expectations, I know I have to jump on to the next slide. So the conclusion I'd like to make is there is multiple hypotheses and that may play a role in GD and ASD co-occurrence. An individual approach is best practice and should be taken and should be considered in Ireland and should be done in Ireland. That's what we should be doing as best practice. At the moment, we have no practice. There are many possible outcomes that can unfold over time. Again, allowing the person explain their story. Not all people go on to have medical interventions. Less than 50% of people, of Irish patients who are being seen by the Tavistock, go on to have medical interventions at all. So that would suggest the assessments were working quite well there with them. An extended period of assessments, which I've mentioned. Decisions around gender may emerge gradually as the young person increases in the ability to think realistically, and that's the thing I've mentioned earlier on, thinking realistically for the future, what this is going to mean for them, and explain. We need more research in Ireland. I'm delighted to say that there is research being currently done by 𝗟R𝗰𝗲𝘀𝘀 and Dr. 𝗟R𝗰𝗲𝘀𝘀, and I really look forward to the findings of that. I know that the data has already been collected, so Clodagh will be doing the analysis, I suppose, in the next few weeks. So that best to look to her, and look forward to seeing that. And finally, Ireland needs a proper multidisciplinary team, gender service for young people, which we don't have, and is causing enormous stress for people, but we absolutely have co-occurring issues. And thank you so much. I'm so sorry that I had to rush so fast through the presentation and change into slideshow. So thank you so much, Jacinta.